Tirshan Baloha from BSN 1-19 in Our Lady of Fatima University, and for today I will show you the assessment of male genitalia and rectum. So let's start prior to assessment. First, we need to identify the client to give the right care and management to them. Introduce yourself to the patient and explain clearly the procedure because it allows them to understand and encourages compliances throughout the assessment. And provide privacy by closing the door and curtain so no one from outside can able to disturb the patient in doing the assessment. And also don't forget to properly wash your hands for infection control. Good day, sir. I'm Tirshan Baloha, student nurse from Our Lady of Fatima University, and today I will be your student nurse. May I know what is your name? Okay, and age? How about your birthday, sir? Okay, so thank you so much. So for today po, sir, I will be assessing your male genitalia and rectum. And I will be just asking for some series of questions. Okay, so para po ma-determine po natin yung past histories mo po. So first po is, may mga nararanasan po ba, sir, na any incontinence po, like leakage po ng pag-ihi? Okay, wala naman. And yung frequency naman po ng pag-ihi natin, okay lang din po ba? Okay, good. And tanong ko lang din po, sir, there are symptoms po ba na nararanasan nyo like STD or sexual transmitted disease? Okay, wala rin po. So, and how about inflammation po, sir? Nakakaranas po ba sa ating inguinal area po, which indicates hernia? Alright. And ask ko lang po, sir, if may family history po ba tayo ng may prostate or testicular cancer? Okay, wala din. So, good to know, no? So, first that I will inspect is the penis of the patient. Okay, so inspect the base of the penis. Okay, inspect the base of the penis and as well as the pubic hair there. Okay, and note if there is any hair growth pattern and an excoriation. Okay, and erythema or infestation as the base of the penis. And in the pubic hair, that's what I can see is the pubic hair is coarser than scalp hair, and the base of the penis and the pubic hair are free of excoriation from erythema and infestations. Next, we inspect the skin of the shaft. Okay, so we're going to observe if there are any rashes, lesions, or lumps. Okay, so as at what I've inspected, the skin of the penis, it is wrinkled and hairless, which is normal, and free from rashes, lesions, or lumps. Next, I will be going to palpate the shaft for hardened areas or areas of tenderness. Okay. Okay, and as I palpate, the penis is soft and plastic. And also, it is non-tender. Next, I'm going to inspect the foreskin for color, location, and integrity of the foreskin. And as what I can see, the foreskin is intact, uniform in color with a penis. And next, I'm going to inspect the glands for size, shape, lesions, or redness, and location of the urinary meatus on the glands. Okay, so the glands and shape vary appearing rounded and broad the surface of the glands and is smooth and which is normal. And it is free of lesions or any redness. Now we need to palpate for the urethral discharge. Okay, by gently squeezing the glands between the index finger and the thumb. Okay. Okay, so the urinary meatus is normally free of discharge. So in scrotum, inspect the size, shape, and position of this scrotum. So I'm observed for any swelling, lumps, or bulges. Okay, so we are going to ask the patient to hold this penis out of the way. So as what I can see in the scrotum varies in size according to the temperature and then the shape. Next, we inspect the skin color, integrity, and the presence of lesions or rashes. Okay, so the skin is thin and elongated with a little hair dispersion, and its color is slightly darker than the penis. Okay, and like free from lesions or rashes. Next, I'm going to palpate the scrotal contents, okay? So between your thumb and first two fingers, note size, shape, consistency, and presence of tenderness or nodules. Okay, so I palpate each spermatic cord and vas deferens. Okay, noting nodules, swelling, or tenderness. Okay, in the first two fingers, so we need to note the size, shape, consistency, nodules, muscles, and if there is any tenderness. Okay, so as what I palpated, it is equal directly in size, shape, and they are also smooth. Okay, firm, rubbery, free of nodules and tenderness. Okay, so to pressure epididymis is not tender, smooth, and softer than the testes. And we are also going to palpate a spermatic cord, each spermatic cord and vas deferens, okay, from epididymis. So the inguinal ring, the spermatic cord, okay, will lie between my thumb and also my finger. Okay, note for any nodules, swelling, or tenderness. And the spermatic cord vas deferens feels uniform on both sides. Okay, the cord is smooth and tender and droop-like. Next that I will assess is the inguinal area. Okay, inguinal area. So first I'm going to inspect for inguinal and femoral hernia. So watching for bulges while the client bears down. Okay, so we ask for patient to turn their head and then cope. So the inguinal and femoral areas are normally free from bulges. Okay, and then I'm going to palpate for inguinal hernia. Okay, so observing for bulges or masses, and have the client shift weight to the left to palpate the right inguinal canal. And place index finger into the right scrotum and press upward to the slit-like opening of the external inguinal ring with finger in canal or external inguinal ring. And ask him to bear down or cope. Okay, and repeat for the left side. And then palpate for femoral hernia. Okay, so on the front of the thigh in the femoral canal area. And ask him to bear down or cope while feeling for bulges and repeat to the other side. And then palpate for femoral hernia. Okay, on the front of the thigh in the femoral canal area. And ask him to bear down or cope while feeling for bulges and repeat to the other side. Okay, and lastly, I will assess for the anus. For the anus as well as the rectum of the patient. Okay, so in this type of procedure, I will place the patient in a sense position. Okay, and I'm going to inspect for the perineal area. Okay, so inspect for the anal opening and surrounding area for the lump, or if there's any ulcers, lesions, rashes, redness, or fissures and thickening of epithelium. And then next, I'm going to inspect the sacrococcygeal area. Okay, for swelling, redness, dimpling, or presence of hair in pilonidal area. And as what I can see, the area is smooth and free of redness and also hair. Next, I'm going to palpate the anus. Okay, so we will be performing a rule of informing the client that we're going to insert our index finger. Okay, so as I insert the client on sphincter for the entering my index finger. Okay, so which is normal. So next, I'm going to palpate for the rectum. Okay, so noting if there's any tenderness, irregularities, nodules, hardness. Okay. Okay, so as I palpate, the rectal is smooth, soft, non-tender, and free of any nodules. And then I'm going to palpate for the peritoneal cavity or for tenderness or nodules or rectal shelf. Lastly, I'm going to palpate the prostate gland for tenderness, size, shape, texture, or irregularities. So as what I've palpated, it is non-tender and is rubbery, which is normal. Okay, so that is the end of our assessment. Okay, so thank you for your cooperation, sir, and thank you so much.